So thank you all for joining. I know it's been a really incredibly busy time, and there's a lot that's been going on with PFAS since our last meeting nationally. And I know you've all been following all that's been released with the EPA and the White House reports, and some of the updates with each of the communities, and the medical monitoring news that I know many of you have obviously been involved with. So thank you for joining us. And I see Emily's coming on, so I'm just going to pause for a second. I think her audio is on. So hi, Emily. We wanted to meet today because we are actually very close to actually starting the study. We finally, we have our staff in place in Newburgh, and they're starting actually next week. They've been training, but they'll have even more training on our protocol. So just to kind of give you a sense of what happens when we hire staff for any study, and the staff that will be collecting the data, so the questionnaire data, the blood pressure data, they'll do the blood draws. There's an extensive training that needs to happen so that all of the data are collected appropriately with the protocol in place to make sure we meet scientific standards, and also to meet our scientific ethics rules for confidentiality and safety, because in this case we're collecting blood and we're also working with children. So there's a lot that needs to happen in terms of training the staff. And so we have the group hired in Newburgh, and we have several people hired in Hoosick Falls. The Hoosick Falls hiring has taken slightly longer than in Newburgh, but we're very close, and we within a couple of weeks for each of the clinic sites that we'll be able to schedule clinic visits. So what our plan right now is, we've started to put together a list of everyone that needs to be notified, so that we're about to start the study. So we have elected officials, and we have county health departments that need to be notified, local providers that need to be notified. And that information will come from a joint letter from me and Betsy Lewis Michael, who's the co-PI. We'll provide them the official information in terms of the start of the study. But one of the goals we'll work on later tonight is developing a plan for working directly with the community. So once we do start, we want to have opportunities for me and other members of our staff and the clinic staff to meet and interact with community members who might be invited to this study, so that we can answer questions and they see us and they get to meet us and can be involved in that way, and we can answer questions that they may have. In terms of the study itself, just to refresh your memories, when we say we're starting the study, what that will mean is that we'll start mailing invitations. And the invitations will go out in batches. We'll mail a batch each week to each community. We usually start out with a smaller batch just to get the systems going and make sure everything's working appropriately. And then we will increase up to about eventually, probably after a few weeks, get up to about 150 a week in each community. And when people receive an invitation, they will be instructed, and they want to participate, they'll be instructed to call our contact office here at Albany, and there will be an eligibility screen, and then an opportunity to schedule a visit. If a child is being enrolled, there will be 2 visits. There will be a follow-up visit to do the neurobehavioral assessment. And that'll also provide an opportunity for the people to call in as they do the scheduling to ask questions as well of our staff as they work with them. Because we're mailing out in batches, we're not mailing invitations all at once to the whole community or to both communities. So the process is going to take 6 to 7 months to get the invitations out. And so and that is why I certainly anticipate being in the communities regularly over the next 6 to 7 months to answer questions and to remind people of what is happening in terms of the study enrollment. And this is because we, with each clinic site, we have so many visits per week that we can book into that schedule. And so we have a very consistent approach in terms of the mailings of the invitations. We'll take a week off during that holiday stretch in terms of lots of mailings. If people want to come in for visits, we may have a couple days in there, but usually we slow down our mailings the week of Thanksgiving anyway, is a normal course of action, and the end of December. We anticipate being ready to mail the first invitations to Newburgh residents either the week of the 15th or at the very end of that week or the beginning of the following week. Thanksgiving's in there, so it's a little unsure, but somewhere in that week we hope to mail the first batch, and then the Hoosick area will be right on the heels of that. If not the week of Thanksgiving, then the week after, because we try to avoid sending stuff out the week of Thanksgiving because people are traveling. And so with the first clinic visits to be scheduled mid-December. One of the things I wanted to talk to all of you tonight is what we are interested in doing if people are willing. And I don't want anyone to tell me publicly over the Zoom tonight, but if what we would really like is if the CAP members would like to, and who are interested in participating in the study themselves, if you were interested in that, we would like to actually have you go first, so that we can send your invite and then have you go through the whole process with us, so that you can provide us feedback. So that means your visit might take a little longer, your phone calls might take a little longer, but it's because we'll ask them, we'll ask you to give feedback about the process and to help us make sure everything is working smoothly, and all of that. The reason I don't want you to have to tell me right now is that under my ethics, we have to keep everything confidential, and we want your data to be used as part of the study. So we're gonna, the only thing different here is that if you are interested, we'll have you email our pfas@albany.edu email and let us know. And then my staff will send you an invite and have you go through the process like everyone else. It's the exact same process. And that way you could also give us feedback and also make sure the mail gets to you and all those little things that we always like to double check. So, and I'll remind you again at the end of the call, and we'll also put this in an email, but if anyone on the CAP would like to help us out in that way, that would be great. And then again, by following all the protocol and rules, your data will be included in the study. So that's why I'm kind of sticking to that mindset. Didn't want anyone to raise their hands in this process. So if that's definitely an option, and we would certainly appreciate that help, because it absolutely gives us opportunity to things that we can tweak. We can't necessarily change the scientific protocol, but there are things that we can do in terms of the order of how we do things or how we greet you, how the flow is working in the respective clinic sites, as well as the mailings that we send out, and are they appropriate and received the right way. So I'll remind you about that at the end of the call. So I'll pause there for a second and just take a moment and see if there are questions at this point.
Erin?
Yes.
About the area that in Newburgh you are restricting yourself to, is it just the city boundary, or does it include the town of New Windsor and the town of Newburgh?
It is the city water utility system, so it's those within the boundary of the water district for Newburgh.
Okay, whoever's using Washington Lake?
Yeah,
okay.
That were exposed between 2005 and 2016. So, okay. And on the public water during that time period.
Yeah, the reason why I asked is that I get used to the school district takes in all those areas.
Yeah.
And the kids move between them all. So, so you're talking about the residents just in the city boundary using Washington Lake.
Yeah, and that's helpful for me to remember. And I grew up in a regional district, so I understand that. We had 3 separate towns as well. So in terms of communicating with schools, because one of the key communication points in meetings that we want to schedule in the coming weeks would be with school board members, school officials, and providers, because we will be asking consent from those who participate to abstract information from the medical records and from the school records for the children as they relate to neurodevelopmental outcomes, because that's one of our hypotheses that we want to explore. And so we want to obviously notify the school districts that this is happening. It's only with consent, and we will work with the districts to make sure it's we don't add undue burden to the workload. We will provide assistance for that. So, but we want to be able to answer questions. So that's helpful for me to know from a communication standpoint that there are multiple families, and so we'll need to make clear with the school district that these are for the folks that are within the Newburgh. But for those who had a residential history from 2005 to 2016, so even though they might not live there now, if they were living there during those years, they would still be eligible.
Right. Okay, thanks.
Okay. I see Suzanne on. Suzanne Triplett, if you remember, is from Research Triangle Institute. That is the group that we have subcontracted with to help us hire staff and to oversee the data collection at the clinic sites. RTI, as I mentioned before, did the World Trade Center studies, and we're particularly pleased they're helping us because they're also coordinating the data collection in Pennsylvania and Michigan. So it's actually really helpful for us to be able to streamline all those efforts, and because as you can imagine, we have to get 7 different places online at about the same time with the studies. So it's really helpful that they've been here. And I know Suzanne's been at both clinics a good portion over the summer, and she was in Hoosick last week and a little bit in Newburgh as well. So I was hoping, Suzanne, you could introduce us. I know they're not there, but provide the names of the folks or the office managers for Newburgh and Hoosick, and just let us know who's there.
Sure. We have an office manager and a team lead in our Newburgh office, and it's at 327 Fullerton Street, that office, and it's coming together really nicely. As Erin mentioned, we've just started a few trial runs, but they're real participants in our Pennsylvania office today, and those went well. We've been collecting data for the multi-site study in Michigan for about a month or 2 now. We already had functioning clinics there with full teams. So we were able to start a little earlier in September with our full protocol and training, as Erin mentioned. But the Newburgh team is well underway on setup and hiring, and we're onboarding staff, and as Erin mentioned, getting ready to put them through a rigorous training program that will last about 3 weeks or more with certification at the end of it. So we have a good team assembled there. It's being led by Roberta Chambers in Newburgh. It's all local teams that we're hiring, and Keir Graham, who's our team lead in Newburgh. And I was just there as Erin mentioned. It's a wonderful smaller site office, but great team, and very knowledgeable about the community and the exposure, and passionate about the research, and very interested in caring about taking care of participants who come in. And we're working through, as Erin said, all the logistics of a complicated protocol that takes a little while to collect the information, the health information, draw the blood, take the blood pressure, all of those things that we're practicing to make that seamless. So as Erin mentioned, we would love a few volunteers. We're starting also with our CAP members in Pennsylvania as well. And it's a slightly larger pool that we started with there of a couple hundred, also former PFAS participants that have taken part in other health studies in Pennsylvania that had signed up for our November time slots. And so as Erin mentioned, Newburgh will be kind of following on the heels of Pennsylvania shortly after we complete this training of our interviewers and our phlebotomists, and our site office manager and team lead are wonderful, and finishing up site office setup right now with the groups. So that's Newburgh. And in Hoosick, I was just there. We have a site office manager who's local as well, Teresa Lesser, just really started. So we're getting Teresa a little bit more acclimated to the site office and the procedures right now. And so Hoosick will, will follow closely on the heels of Newburgh in terms of, schedule, and we're working through that with Aaron right now. But we also have other individuals that we're hiring, local trained phlebotomists, staff to administer the health interview. Also one staff member who will also do our lab processing tasks. So it's all of those are important roles, and we're really looking forward to receiving CAP feedback, as Aaron said. Once you go through the full study protocol with us. We just finished that up today in Pennsylvania and received some nice feedback, and it just helps our teams refine the process before we start recruiting more aggressively in the communities, getting people to sign up. We start usually a little bit at a slower pace with individuals who are a little more familiar.
So thank you very much, Suzanne. That was helpful. So, and I know, I think the Newburgh folks were able to meet some of the Pennsylvania folks and did some training with the Michigan folks as well. So that was
right.
Really helpful. So they've been able to meet everybody.
We meet and support one another. It's a unique study, and working at these site offices with all of the rules in place just requires support. So we do a lot of cross-site communication and mentoring right now. We might have members from Michigan, a few of them, come out and support New York as well. So we're looking forward to getting that underway.
Thank you, Suzanne. And I know my staff will be part of some of the training next week with everybody, and then we will be setting up in-person time to meet both of the staff so they can meet me. And we will, one of the things we plan to do on our website, and we're in the process of updating our website to make it a little bit easier to distinguish between the literature that we've posted and the science we've posted. And then now that the invitations are going out, people will be able to go there to find, study protocols. What does it mean to participate in the study? And they can click on that, have additional information. And in there, we will also have links to some YouTube videos of our staff members and some pictures and a walkthrough of what the actual visit will be like. We've done that in the past for our kids studies, and we find that particularly for children, that is actually a helpful thing, just so they can see what will be going on at the study. So we are in the process of working on those updates as well. What I was hoping to discuss a little bit today, I've had I've had meetings with Mr. Lawson to chat about groups, community members and groups, some of whom I've met, others I've yet to meet in Newburgh to start scheduling meetings for me to come down and also to schedule. We sometimes call it a launch, where we, at the early stages of a study, we usually have a larger event where we can invite people from the community. It's, in this time of COVID, these things are always a little bit more challenging. We were thinking about having an open house. And in Hoosick, that's actually a lot easier because we have the house. We have the clinic site. Newburgh's a little bit smaller, but I think if we find an opportunity or a location where we could have an open house where people can come and meet and meet our staff and answer questions, that would be one event. But then the rest, really, what I'm interested in hearing from is who should we be meeting with, and with one-on-one, and I can give some presentations, but really want to have conversations with people to answer questions and to talk about the study, talk about what they're, what they're interested in, what they would like assistance with. So, and to really let people know about the study. And I've heard from several of you offline. And so, clearly, again, as I mentioned, we'll have this first phase where we need to, and we'll notify elected officials. We'll obviously be notifying providers and local health departments. But for examples, in Newburgh, I hope to meet with the local pastors at the local churches as well as the NAACP. There are local with the school board, as I talked about, other local groups. Environmental Advocates has also been working with Newburgh, and I'm happy to meet with them. And so we in Hoosick, I gave an update to CPWG, and we have the elected officials, but are there other groups in Newburgh and in Petersburg? I can come out to Petersburg, or we can do something jointly. What do you, do you have some thoughts on that?
If you were to come out and do Petersburg, it would probably be best to wait until we have a whole new administration in the town board.
Okay.
So it would be best to wait until after January.
Okay, and that actually makes sense, because again, as I mentioned, I anticipate meetings throughout this process, and actually the mailings related to those who are on the wells in Petersburg and Hoosick that will be invited will probably go out in January. So that actually makes a great deal of sense to have the Petersburg meeting align with that. What do you think about the idea of an open house early on, November, December, at the clinic site to meet people? Is that something that would be of interest? Do you think Hoosick's they just want to wait for their letters? What do you think?
I think it would be a nice idea. The challenge would be to get people there. You know,
Yeah.
It's challenging enough to get people to go to our community center to hear you talk that first visit. I think we had 20 to 25 people in the
Yeah.
room, and 2 town board members, and that was it. I guess we need to think about that, maybe throw that around with our
Okay.
CA committee, and see if we could actually get people there. I think it would be great to go see the actual facility and, the house in Hoosick Falls, though.
And there's a lot of confusion going on right now between the health study and the health monitoring.
And the monitoring. Yeah, and that deadline's December, right? For
Yes.
the medical monitoring. Yeah, and we fielded a couple of emails related to that, and we're aware of that. We're going to add that as a question on our website so people know the difference between the two. We don't want to, we want to just be very clear so everyone understands that, and I'm happy to speak to that too individually. We're also working on, actually I can share my screen related to that, and then we'll get back to asking the same question for Newburgh, but we're working on a infographic as well that shows the differences between the other types of programs in the 2 communities and the multi-site health study. And so I think we've circulated this to you once before, but we'll circulate it again for additional comments. And and again, what you think of this is something we can at least put on our website, but also have available when we do talks and things like that. Mr. Lesson.
Yeah, I'm concerned about the outreach and recruitment strategy to get the numbers that you guys are trying to get. So I think obviously having open houses is great and important, but I think what would be really interesting or important for us to hear is the strategy to actually recruit and to get participants in. I know you have a process and you're mailing it out. I'm just concerned that that's going to be enough to get people into.
No, I fully agree. And I know we've specifically talked about that with Newburgh, and I don't intend, the open house was more of if people wanted to have a way at the beginning of the study to meet people, and we don't have to do that. That was just an idea. In terms of the recruitment and the community engagement, we've talked about, so that in terms of the science, the recruitment process is people are randomly selected from our population list and are mailed invitations randomly through the selection process that we have throughout this 7 to 8 month period. each week they'll get the invitations. In terms of the community engagement, and this is particularly important in Newburgh, what we anticipate is, again, the invitations are coming out all around Newburgh. They're not neighborhood specific any one week. So it could be, in one neighborhood, maybe 3 people get an invitation, but maybe no one gets an invitation in the neighboring apartment complex that week, but the next week they might get 3. So it is a random process in terms of it's a little bit more complicated in Newburgh because it's bigger. And so it comes through. So what we anticipate is, me, but also the staff at the clinics and others and staff here coming down on a meeting in the neighborhoods on a very regular basis to say, hey, here's if you see this invite, and we have some ideas for posters and information flyers that can be hung in throughout villages in the city, as well as media and Facebook and the traditional stuff. But there's really nothing that can replace the face-to-face and saying, look, this is an invitation, this is what it looks like. We would really like it if you could open your mail and respond. If you get one of these invitations, this is what it looks like, and you can enroll. Now, one thing we did talk about in Newburgh in particular, if we think it might be helpful to have a few centralized, and centralized loosely, but a few areas where we come down with our computers and we could actually enroll people and schedule them for a clinic while we're there. And we could do that. We still have to run through the screen, so it would take some time. But that might be an option that if you think that might be effective. But again, we'll have to figure out where they would be because of the randomness of how we're mailing out the invitations. Did you have other thoughts, Ed, on how we could do that?
No, I think you're subject to what you can do based on the way the funding was written. And so, but I think the emphasis on mailings and then engaging the communities will have the twofold effect of both tracking some people who are receiving or have received or will receive. And I think that's the posture that you could take when you're doing these presentations in communities. You may have received one, or you might receive one in the future. But while we're here, we want to share with you some information about PFAS and general health as well. So even if you aren't participating in the study, the information is still worthwhile for you to hear, because you may have or exhibit some symptoms and you may want to go visit your doctor, period. So I think it is what it is, but I think it's important for us, for the study, to do both and. We can't just rely on the mailings. The other thing I would suggest too is any other mediums that will be able to inform the community about exactly what's happening. So I'm thinking, as Jack was mentioning earlier, maybe engaging the school district in a more significant way. Also, as you mentioned earlier, the health departments and the local providers, they also can provide access and information about the study. I think all of these things, and obviously meeting directly with the community, are going to be ways for us to get and kill a couple of birds with one stone. One, informing the community, even though they may not be a part of the study, but two, also informing those that are going to be a part of the study about what the process is. So that's my take.
Okay. The other thing I've thought of, in trying to figure out how it would work given the parameters of the epidemiology design, is having people go out, not unlike what they do for the census in the neighborhoods, and say, hey, if you've received this invite, would you be willing, can you participate in this study? Because again, the challenge here is that it's based on invite. So it's not just based on people contacting us and enrolling them in groups. So that's part of the challenge that we have. But we can certainly do something like that, or, as we've talked about before, attending different community meetings that are in congregations to, again, if you've received this, or or you may receive it in the future. This is what it looks like. This is what this is about. And here's some additional information, perhaps in combination with what's going on with the RAB as well. And we can continue to look at that. Are there other mediums we should explore that we haven't listed?
Yeah, because I spent so long in the school district, I talk about
Yeah.
that a lot. You got to keep in mind there are about 900 teachers. There's about 10,000 students in Newburgh.
Okay.
And the kids move about all of the buildings. They all eventually end up in NFA. So you have 3,000 to 4,000 kids there. The teachers need to know what's going on because this is going to be discussion that the students will have. So somehow get to the teachers to be able to make sure they have accurate information to understand what these conversations may be. Certainly the nurses would be a group that would be involved.
Would you be able to help us make that connection?
Well, I would certainly be able to speak with them and discuss, and help maybe answer some questions and that sort of thing. Oh, absolutely. I don't, to go, make sure we get the school board on track and then move towards the teachers. Because of the student conversations and what's going on, and it's been an issue for 5 years or more in Newburgh. So make sure everybody understands what's going on.
So what we can do is try to get on their calendar if they have a meeting coming up or an opportunity for us to meet with them and let them know what's going on. And if you have some contacts, that'd be great. Okay, to come with us.
Yes.
So that'd be super. Okay. Anyone, any other? There's the group that with Mr. Lawson's help, we've made initial contact with, and we're gonna again work together to continue to meet with the local pastors and the environmental work group of the NAACP. We'll also reach out to Riverkeeper and Newburgh Clean Water because they've obviously been involved from the beginning. Is there other, but in terms of community engagement and enrollment, I think the most productive groups would be the within the community and people within the neighborhoods. Are there others that obviously the providers, but are there anyone else?
Another location I was thinking of is just the library. There's a lot of movement through the library in Newburgh. The lobby has a great space to put posters and to even have a small meeting there in the lobby of the library.
Okay.
And of course the armory in Newburgh too.
Right. Okay.
A lot of kids come through there. A lot of parents come through there. The armory is very busy on the weekends and after school.
And I think if my memory serves, that's also particularly on Saturdays a congregation point for some of the Hispanic families.
Yes.
And that, so we could have bilingual.
Definitely at the armory, yes.
Okay. All right. We have our posters. I mean, would people like to have posters that we hang in the communities in different popular congregation sites and I can show you what, a mock-up of what we have. Let me get to the right page here. Hang on one second. We have to be used to this by now. Here we go.
Emily has her hand up.
Oh, hi, Emily. Sorry. Go ahead.
All right. I just wanted to touch back on what Kathy had said about Petersburg and the people being confused about the medical monitoring. She's referencing to the settlement, not to what DOH has been doing.
Right.
So like maybe some verbiage, how it doesn't have anything to do with that.
Okay.
I mean, hopefully, like, for blood draws or something, if they needed to be done, they could be done at the same time, but I don't know if that's even going to be possible. And then the second thing is I'm going to email you a list of the school board's meeting dates for the rest of the school year.
Okay,
And then you can go off of that for Hoosick Falls.
okay. Thank you. So this is a mock-up of just a post-it. We had actually designed this for Hoosick, but we're happy to because that was a request that we had early on, or an idea for yard signs and posters, and we can obviously print them up and have them bilingual for Newburgh if you think it would be helpful in Newburgh. That was one of the questions I had.
Aaron, on that graphic that you have up right there,
Yeah,
can you grab that as a JPG and email it to us? Because then we can pop those into our social media pages.
yeah, we're happy to do that. We can do that. I should rephrase that. I have my staff who are younger than me that know how to do those things. We'll do that. But yes.
Yeah, because if I just put just that on my Facebook page, people are going to see it, or Twitter or whatever.
Okay.
And I don't know if this matters. I just know that a lot of people I know, if between December and January, people either need money for Christmas, or after Christmas you're broke and really need money. Is there any way you can like highlight the gift card part? Not sounding materialistically, but if two family members and a child got $75, that could be really helpful.
Yeah. So we have to, for my ethics requirements, one of the things that are always reviewed is whether or not we're being coercive. So the IRBs are very strict on making sure we're not trying to get people aren't participating solely for the money. And that's an ethics requirement that we have. So I can't, and we have approval for the 3 gift cards. That's not a problem. I just can't say things like, hey, you need money, come participate in the study.
No, like just make it like in a bold print.
Sure, we can
something.
elevate it and say, for those who complete all, for those with children, it's up to $75. It's 3, if they complete all 3 components. For adults, it's up to $50 in gift cards.
Right.
And we can elevate that information, not necessarily saying, this is what you'll receive as part of that.
Because I honestly think that's going to catch some people.
Okay, all right. So that's good to know. That's good feedback. And yeah, we can do that. I just can't. I have to because we're evaluated on those things, and for good reason. There are some ethical things there, but we can definitely provide that so people know that it is a thank you, and it's there is time. These visits are long, and they have to travel to get to the site. So we're very cognizant of that. So okay, so we can provide that. For Newburgh folks, would something like this be useful or not in terms of just hanging up other information, or just stick with our in-person meetings, or what do you think?
I think somewhere. Go ahead, Ed.
You could go, Jack. I'm sorry.
Yeah, some pieces like that, little things like that, saying check your mail, that kind of thing. I think that just helps. Okay. I don't think it's going to be an issue at all. So I can see that in the library, just on a window, in a doorway, or wherever it may be. I don't know about if schools will allow it, but you would have to check on that.
And if we were to print these, would people be able to help us?
And the armory too, and the armory also.
Okay, and we can definitely have them in different languages. Ed?
So, yeah, I think I like the flyers, but I like the information. So if it was linked to an infographic, so if you could do the QR code and there was information about PFAS, and specifically up-to-date information about where we are in the remediation process, where we are.
Yeah.
So
okay.
So again, this is about that, timeline, and because it's about information, and information received in a way that's digestible. You know what I think would be interesting? If the QR code could download a video, if the QR code could download information graphic. I'm get your bang for your buck. It's not just that cute flyer. You want to try to connect people to this and use it as an opportunity to share information. You know, with the other thing that is interesting is that I've seen or I've heard of how the QR code can update itself. So every time, if you can scan it and you can provide new and rotating video or information, it would be interesting to see, you know, because we talked about videos, we talked about what we call it, information, infographic and timeline to be able to share information. One of the things that I think we would like to highlight is, you know, Jack's organization and we have quarterly PFAS meetings, and we would want more of the community to come and participate. I mean, gratefully and thankfully, Newburgh has been approved. We have funding, and we're starting our RIPFS process. That's great, but I don't know how much of the community knows about that, and we need their voice. We need their voice, and so any information that can be shared, I just don't think you should just have it just be a cute photo about your study. Make it get more bang for your buck.
Okay, so and this is where I have to figure out QR codes. Can we have multiple things affiliated with one QR code, or it could probably go to a page that has information on the it could be Newburgh specific and go to the Newburgh page with information on the RAB, information on PFAS, and information, like you said, could be one of our videos. It could be information, you know, where the study is. I mean, we can play around with that. So that's great feedback. Let's go back. I'll talk to our media and marketing folks and figure out what's possible, and have that, you know, go to, you know, could go to a specific page on the website that has that information, and link to your RAB. So, okay. That's a good idea. All right. Emily, your hand's up? Or is that from before?
From before.
Okay. Okay. All right. So we'll work on, we'll play around with the QR code and information. And we will definitely resend you the current infographic we have on the multiple efforts going on to get your feedback there. And, you know, thoughts on, for those in Hoosick, you know, again, we're going back and forth on this, the difference between them. We know people are going to be confused with the medical monitoring related to this settlement. So the infographic is focused on the DOH biomonitoring because that's what's happened in both communities. And then we were going to add a question or, you know, with an answer to the website. But if you think that it's going to be such a big area of confusion that we need to add it to the infographic, let us know, and we'll play around with some language on that as well, to do that. And then, so I'm trying to think. So I'm not hearing a whole lot of love necessarily for an open house in Newburgh, which is fine. But what we do need to do is schedule some initial meetings. And Mr. Lawson, I did send you an initial draft today with an initial list for the folks that we met with in August. And Mr. Caldwell, I can reach out to you, or my staff will, to generate a list with a school district and the school nurses, which is another super idea. And you're right. And then we're working on language for the providers and the groups that are already involved in that area, Riverkeeper and Newburgh Clean Water, and we'll get those missives out. But I think what I'm focused on now is to really communicate directly with potential community members who may be potential participants, so that and to set some dates when we can come down and you know, answer those questions and provide information and you know, keep continuing to meet to follow through on that, and in partnership, you know, with the RAB, because I know you have a lot going on there, and so that we can share information as together around the issue of PFAS.
I'm not against the open house. Can you share sort of what the purpose and intent is? What are you trying to accomplish with the open house?
Yeah, and so the open house was really when we had originally put it out there, was an opportunity for people to meet the researchers and the staff, and if because elected officials are interested in this study, we didn't know if that would be something they would want to participate in it or not. I'm not necessarily hearing that is of interest right now. They've all been very busy, obviously, with the election season, but it was really just an opportunity to meet people. But it's up to
That's
you.
a good idea. I think that's a good idea. There's nothing wrong with,
Okay.
building relationships. I think that's really important. I thought for whatever reason that it was focused on participants. And since it's not focused on specifically participants, yeah, I think it would be great to do that.
It's more of a community thing, and it's but I think the real challenge is, as has been raised, that whether or not people would come. So and whether or not we could get people there. So whether it's something that needs to be in conjunction with another meeting or something. It was an initial thought.
Let me just throw one more thing in there. It was mentioned about the parking and all, because you're in a complex with other doctors and other things there. It might be better to have this open house on a Sunday or Sunday when the parking lot is more available.
No, that's a good idea. We could do that. Because the clinic itself is a little bit smaller, but if people wanted to see it or meet with us, and we can definitely do that. So really it was just more of a meet and really get to know us and just have our faces, because we are it was just a way for people to get to know us, and as we get going with the study. And it could be we schedule that after we've mailed out a few we're a few weeks in, so that people see the clinics up and operating. So that was the idea there. But the participant one, the potential participant, I'm realistic that the open house wouldn't necessarily be geared to that, because I don't think that would be effective. It's more the participant one would be as people start getting invitations and being able to say, hey, this is ongoing. You might have heard about it on the radio. We're going to have some radio placements, some social media placements. You've seen posters around town and signs around town. News articles, this is what it's about, and to have the personal contact, and again, when we go to the churches or go to the different community groups, to really do that and to spread the word for those who have been involved from the very beginning about this effort, to also have them help spread the word a bit.
Erin, I'm gonna scoot. I'm gonna let Emily finish listening.
Okay.
I have another meeting. I'm trying to split my time that started at 7.
Okay.
So
Thank you, Lorraine.
if there was anything else, just pop me an email that you think of or whatever, and Emily and I can discuss whether an open house here would matter, I guess. Or not matter, but would we be able to get anybody to come?
Yeah, and if that's not, if that's just if our efforts are better served elsewhere, we're happy. That's why we wanted to ask you. Sometimes people do these big launches like they did with the TSDR exposure assessment right before the shutdown. Had a big community meeting, but we've kind of been meeting with folks all along for a while now, and people have different comfort zones with big things. So do we, and we're happy to do something like that if people thought it would be important and would help with enrollment. Otherwise, we're perfectly fine going to really person.
And we don't want to waste your time either. I mean, so we'll toss that around privately, and I'll let you know.
Let me know, and or if it's joining another meeting for something else. But I just so people can get to know us and get to know the staff. I mean, I think that's particularly important.
Okay. All right. Thanks, everybody.
Emily, I see your hand up. is that?
I don't know how to take it down.
Oh, I'm sorry. I thought you had taken it down. There's, yeah, there, where is that? Under reactions.
I got it.
But no worries. You go, okay. All right, other thoughts, other ideas?
As far as Petersburg goes, I think the way to start in this area would be posters, pamphlets, lawn signs, things that we could leave at our library, town hall, and their community center, where in churches where people frequent. I think that's the start. It would be nice to have a open house somewhere and have our whole C8 committee and town board. I'm not sure that's going to happen, but that's something we'll run by them, and I think we'll ask our town board.
Yeah.
Right. Let's put it on them, you know.
Okay. And whatever they want. And or if they just, you know, we can do stuff over Zoom, we can do stuff in person. It's whatever people.
For what it's worth, I thought your Zoom presentation that you did last week in Hoosick Falls for the CPW group was great.
Oh,
You know,
good.
I'd love our whole community to see it. I stopped by our town hall to talk to our supervisor and said, you know, Zoom is the way to go because you can show slides and it's really clear, it's succinct. In 15 minutes, you're in, you're out, and there's a lot of information. And I think that might generate a lot of interest. Again, the challenge is, how do we get people to participate?
All right. And we have, I don't know if we've uploaded that one yet, but we upload the videos of those presentations to the website too. So if people have missed it and want to hear it, they can watch. So good, thank you. That's excellent feedback. And again, this is where each community is slightly different in this way. So, you know, we anticipate doing different, not necessarily doing the same thing in both Newburgh and Hoosick Falls. We know that in the Petersburg area. So, you know, we definitely want to be responsive to all the different communities and their needs. There, Jack, did you lean forward? Did you have an idea?
Well, it was just after people receive the invitation, how would the mechanism for making an appointment?
Yeah, so let me pull that up. They'll receive an invitation in the mail, and there is a, show you. They'll be asked to call a toll-free number, and this was a part of the protocol that was handed to us. This is not normally how we would have done it, but it is what it is. So they call our toll-free number, but they can also email or text us initially to make an appointment to do the call, where we run through a brief eligibility screen, like 10 minutes, and then can schedule the appointment at their convenience. We'll give them multiple different times and days that they can pick from. And again, for children, there'll be 2 visits scheduled, but we'll schedule them at that time. And this flyer is actually 2-sided, and on the other side of this, I don't think I pulled it up, is just a background information on the perfluorinated chemicals and why we're studying them and who the other sites are. So it's a little bit more in depth. So it looks like this, and we can send you actually, when we send you the infographic for your comments, we can send you what this looks like and also the reminders. And then for people that we do send an invitation to, we'll also be sending up to 3 different postcard reminders that look like this, slightly different headers each time. And again, just directions to call us or follow the directions in the invitation packet, which is really just to call us. And we'll have this information on the website as well. We're also going to be adding to our website an opportunity for people to provide us their information if they want to be on our contact list to receive newsletters and other information related to PFAS, but also if they are interested and want to be on our contact list, if they're interested in other opportunities, if other studies come along or we have opportunities to add people. So we're going to add that information to our website. People will have the opportunity to do that. And we have in Newburgh, in addition to the invitation that I showed you, there will also be a language card. So it's basically in English, Spanish, and Haitian Creole. We'll have brief statements that say we have materials in Spanish and Haitian Creole. And we also have staff who speak both of those languages, so who can answer phone calls directly, and we'll have voicemail messages that and staff that can respond and speak and to community members who are more comfortable in those languages, which is you know, again, something we've experienced before. So that's we'll have folks on board for that. Other questions? Let's see. Think. Just double checking. The only other update we have, we are working with a company called OpAd, who will be, they're primarily social media, but they'll help us with both Facebook posts as well as blogs and social media updates. Not everyone in communities are on those platforms, but if they are, there'll be information going out as we begin the recruitment period. Again, we'll be working with our local press office to have newsprint and radio announcements in that area. I think the other piece that other sites are doing for local newspapers, so truly local newspapers and local community newsletters, if we've done some can do interviews with folks. So I don't know if there's a student newspaper and they would like to do an interview with us, we can do that. If there are some local newspapers or newsletters, I grew up with a Penny Saver. This was something that was local, or the Brockport Post, those types of things. If you think that would also be of interest or would reach people and answer questions, where, you know, can obviously we're happy to hear that and happy to provide and to do an interview, or to do an interview with my staff or one of my students. I mean, it's whatever you think might be interesting to people. Any other feedback? Okay, so again, we're hoping towards the end, mid to in a couple of weeks to start slowly mailing out letters, but really our first group, we're hopeful will be members of the CAP. And so if you are interested and would like to participate, it does, and if you're not interested in participating now but want to participate at a later date, that's perfectly fine. But if you are willing and able, just again, email our pfas@albany.edu email that only goes to my staff, and only they can see it, and they're trained in all the confidentiality procedures, and then they can start the process. And again, with the goal of being around mid-December would be the first visits, but we would schedule a call for you a little earlier than that. And then we'll send you an email with the infographic, as well as what the invitation looks like and the poster. And so for comments on the poster and the infographic, the invitation letter we can't change because that's been approved by the ethics board, and again was part of the standardized protocol across all 7 sites, but I will send it to you so you can see it. But really the next thing is, as you think about it and think of ways that we can interact with the community and how best to do the recruitment and get the word out. If you think of additional things, by all means, they can email us again at that pfas@albany.edu, and Gloria will help facilitate that. And I've already sent Mr. Lawson an email with some thoughts on some of the groups we've already been meeting with, but if there are others, please let us know. And we'll be working on our end, drafting language and emails out to the elected officials for all the communities, as well as the local health departments and the providers in the communities. I may reach out once we get that list of providers. I will also send that to all of you just to make sure we haven't missed any. And we want to make sure we're inclusive in that. And so we'll be forwarding that, not tomorrow, but once we have that list together, we'll send that in a separate email. Am I forgetting anything?
I want to piggyback a little bit on what Ed said, but also a lot more.
I think we're great. I just think again, we want to double down and just maybe, I guess, follow through on some of the things that we've been talking about.
Yep.
I think I know you mentioned it. I just wanted to just confirm the Department of Health, the providers, the Qualified Community Health Center, and the school districts, I think are really important for us as a first blush step. So did you explain where we were in that process?
So yes, yeah. So let me go. I mentioned it, but let me go in a little bit more detail. So we're in the one thing that's been put forth. So with DOH, because this is a partnership with DOH, they have put forth some of their press release and information that they would like released to the elected officials. And they're in the process of going through some approval channels for that, and that should be approved shortly. What we're doing now is we're compiling the list of providers and the school board members and the local health department names, and getting that list together and drafting a communication from me and from Betsy as the co-leads of the study, to let them know about the start of the study and provide some information. And so that list is the list I'd like all of you, once we get it together, to just to review it for us and just make sure we haven't left anyone in those categories out, particularly among the providers, because I know that can be, there are a lot of different providers, not just within the standard health system. So we want to make sure we get that together. And so that's the process of what we're doing. Is that what you meant, Mr. Lawson?
Yeah, and so it brings up another point. Yeah, exactly. And it brings up another point. So now when you're thinking about that open house, that might be pretty neat to have the open house with those people involved to, again, strategize around how we get the message out. Because there's also another piece, right? So we know that the Department of Health was here and doing a lot of testing in this community. And there's a lot of still confusion about, okay, well, where do you fall into the loop with this new study? So the connecting of the dots, so not just sending out information, but having the information coordinated. I think we have a unique opportunity to share with the community in a really sort of really engaged way, where we're hitting on all cylinders, where the right hand knows what the left hand is doing, and both feet are walking in step. But when because my only concern is that coordinated messaging that we're going to get. It should be that the message from DOH is the same from the school district, is the same from our offices, and the message that we're being sent. My concern is that it won't be, and then you're going to be in these meetings and you're going to be sending out information and people are going to get confused. Okay. So that's the coordination of the release, because I heard you say something about the DOH doing some things about press release. And I beg that there's a concerted communication, community engagement effort that I beg that, because we don't want to go back to what's happened in the past, misunderstanding, this organization saying one thing, and it's the Department of Health. So now the Department of Health is saying things, and then you're out in the field and you're saying something else that doesn't match them, and it's just all over the place. So the communication engagement effort needs to be, I think, led by you and informed by you, and certainly in concert with everything else that we're saying.
Okay. Yeah, and we've definitely worked jointly on the, because DOH will be updating their website as well, but we've done that in concert to make sure the language is consistent. Information on the core part of the study will be through the same email link and website link that we've been using all along through UAlbany. I'm pausing because as you were talking about in terms of the school board members and the providers and making sure we're consistent, which I absolutely agree with. In what types of resources do you think they would find useful? And we'll let them know about the study, but should we be bringing flyers and pamphlets to them as well to hand out? Would that be of use?
Sounds right to me.
Okay, all right, so and then the QR, I gotta learn about QR codes, the QR code and making sure there's infographic. And then I think you make a very valid point of, you know, a lot of these same people are also simultaneously learning about the RAB and the work you're doing there. And even though it's distinct from the study, just making sure we have resources even on, you know, definitely on our own website, a link to that effort. But also we can, on these posters, if we have a QR code, there might be a way to do that. So we can play around with that. I have Jordan McAdam is one of my staff members, and she's actually meeting with our web designers tomorrow. So we can bat around those ideas. I think that was a really cool idea. But we'll need your help in terms of language and, you know, what is most useful for people. Okay, so we'll send you that email in terms of some initial feedback opportunities. And again, if you would like to be on an initial list of our first clinic visit scheduled for feedback, that would be lovely. And we can do that. We are going to work on some videos as well. And, you know, again, being able to link to videos. And also, I know the other thing we've been talking about, Mr. Lawson had an idea last time with our clinic visits. When people walk in, you know, it's all about making sure people are comfortable and feel good in the clinic itself. And we've been toying with having some videos that at Loop as well that talk about the PFAS and all the efforts going on and things like that. So we'll keep with those ideas. Anything else? Well, thank you very much. We will be in communication quickly with some of this, with the list today, but then also some draft emails and communications with as we start our outreach and needing to schedule and find times to meet with people and how best to do that. And so we'll keep in communication over emails as we move through that process.